Good morning and welcome to Radio Friends on Friday, March the 15th. It's a pleasure to have you with us. I want to introduce you to Dr. Erik Grossmann. It's been 10 years since we have sat across and
It's been a long time. It's good to see you again.
Yeah, good to see you too. You were on the old Pepper and Friends show. March is colorectal cancer awareness month, correct?
That is correct.
And that's what you want to talk about. And you're actually with Columbia Surgical Association, an affiliate of MU Health.
Yeah, we're an affiliate of MU Healthcare, and colorectal cancer is the number 2 cause of cancer death in our country. 140,000 people this year will get colon and rectal cancer. The great tragedy is 60% of that could have been prevented by just getting the proper screening, and only about 1 in 3 of our population goes for their screening.
Why do you think that is? It's a stigma that's attached to the screening, isn't it?
Exactly. People have a great fear of the kind of testing you need done. But the important thing to understand is most people with colon cancers have no symptoms. They don't know they have it. Colon cancers are very curable and very preventable, and the tests are not that difficult. Most of us would say a colonoscopy is the best test, but there are some legitimate alternatives, and so it's important to talk to your doctor. If you decide a colonoscopy is not right for you, there are other alternatives, but you need to bring it up, you need to talk to your doctor, and you need to get screened.
Is that where you can do the test at home and then mail it in?
There are tests that can be done at home, and that's why it's important to talk to your doctor. If you're afraid of the colonoscopy or feel it's not right for you, there are alternatives that you can do, but you need to bring it up, you need to talk to your doctor.
Is there an age limit when you say, okay, you've lived this long, maybe it's not necessary to have a colonoscopy?
Yeah, probably the greatest benefit is if you have at least 10 years to live. So if you're relatively healthy and we think you have at least a decade ahead of you, you're still getting benefit from those tests. Now, there are some people who are too old, too frail, too sick to think about those tests, but that would be an individual decision with you and your doctor. So it's just a discussion you need to have. Am I still the kind of person that needs to be screened? Yes or no? And if so, what is the right test for me?
What are some of the things that you can do as far as your diet to help prevent colorectal cancer?
That is a great question. So certainly there are some risk factors you can control. People who have low fiber diets are at risk. People who are overweight are at risk. People who smoke are at risk. Smoking is a risk for colon cancer. A lot of people don't realize that. And a sedentary lifestyle, if you're not active, that is also a risk for colon cancer. But most people that get colon cancer have none of those risk factors. So everybody who is healthy needs to be screened, even if you don't have a risk factor.
Doctor, I thank you so much for coming by today. You had a lot of good information. And the best thing to do is to talk to your doctor about it. But if people want more info online, you can go to MU Healthcare, right? MU Health.
MUHealth.org.
All right. Dr. Erik Grossmann, thank you so much for coming by.
Thank you so much.
Pleasure seeing you once again. And keep in mind the address is muhealth.org for more information. And you find everything you need there. Now, I want to introduce you to MARILYN McLEOD, who really needs no introduction, from the League of Women Voters.
Good morning.
Good to have you here, MARILYN.
Right, good to be here.
You've got a couple of events coming up very soon.
Very soon.
Correct?
Right. I'll try to be quick about it. Next Tuesday, the 19th at noon, we have our monthly, what we call lunch and learn, although we don't provide lunch. You can bring your lunch.
You bring your own lunch. Okay.
That's right.
Well, what do you call it? Well, you call it lunch and learn because people bring their own lunch to it.
Right. It's a lunch hour event, so people who work can come too.
Right.
And we do this every month on different topics. And this month, Brianna Lennon, who is the new county clerk, will be coming and speaking to us about voting machines, because apparently the voting machines that the county has are now about 12 years old, and it's time for new ones. So that's an opportunity for anyone in the public to come. It's at the Columbia Public Library in the Friends Room at noon on Tuesday the 19th. Mm-hmm. And then, speaking of elections, on Wednesday evening at the library, we're going to have a candidate forum with candidates for the mayor of Columbia and school board candidates. That will be at 6:30 at the library.
Okay, so 2 events coming up.
Right.
I don't know how well versed you are on the voting machine, but I'd like to touch on that again, if we could. when you vote with the voting machines here in Boone County or in central Missouri, is there a backup paper trail there too?
Well, we vote on paper.
Yeah, you vote on paper, and
principally.
then you
Most
slip it
people
in the machine.
Right, right.
Is that what's called the voting machines?
Well, you know what? That's why we have Brianna coming to talk to us.
Okay. I thought with the, I know when we get the sheet of paper.
There are some machines that you can actually
some
vote on.
machines that you actually just vote with the machine and not on paper.
Right.
But we don't have those in Boone County?
I believe there are, or there were. That's kind of the question we'll need to ask and find out about, because it's time for new machines totally. And, technology's changed in 12 years.
Right.
No doubt.
And the big concern is the possibility of hacking. Is there a possibility of those machines being hacked? So Brianna will be covering all of this information.
Yeah, certainly opportunity to ask questions just like you did, which was wonderful. Sorry. That's why she's the expert and I'm not, but that's why we have...
See, I didn't realize, or I didn't think when I, at least in my precinct, I vote in Harrisburg, and we just mark it on the paper and then you take it and you slip it in.
Right.
But I didn't count that as voting with a voting machine. Okay, what else do you have going on? This year and next year is going to be kind of a busy year for politics, right?
Yes. I mean, it's a pretty major topic in our lives.
And the League of Women Voters tries to, you're nonpartisan.
Right.
And you do welcome men into the organization, even though it's the League of Women Voters. But it's a wonderful opportunity to get together and share ideas and thoughts.
Right. So on Wednesday evening at 6:30, there'll be refreshments at 6 at the library. We'll have that candidate forum, which is just local. It's not just local, but it's local races, mayor, and because city council, there's no opposition. There's just one candidate in each ward. So we don't do it if there's no opposition. We just...
Now, do you only deal, this is the Boone County League of Women Voters.
Right.
So you don't deal with the other counties in this area, do you?
No, it's just, you're right.
Does each county have their own league?
A few counties do that are nearby, Moberly, Randolph County, and then Mexico or Drain.
So if somebody is interested in starting a league in their county, how do they go about this?
Oh, let us know.
Just contact you?
Absolutely. We'd
how
be
do you contact you?
Well, you can do an email, go to our website, lwvcbc.org.
lwvcbc.org.
And you can put in a question.
Okay, so if you're interested in starting a league in your county, check them out. They'll give you all the information you need.
Great.
Marilyn, thank you so much for coming by.
Right,
Pleasure to have you. Something you'd like to hear or see, drop me an email, pepperp, missouri.edu. Bye-bye.